Thank you, and good afternoon. Today we are reporting, unfortunately, the single highest number of deaths since the start of the COVID crisis, 15 new deaths reported today. We're also reporting 109 new positive cases, which is our highest daily total reported in more than 2 weeks. We have repeatedly stressed that we don't make decisions based on one day of data. We want to look at larger trends. But today's numbers are a sobering reminder that we must remain vigilant, that we are not out of this yet. While we see calls to immediately open things, while we see large gatherings out together in public, we have to continually be reminded that the progress and actions that we've taken thus far, the sacrifices that have been made, have been designed to flatten and lower the curve, to lower the rate of transmission, to lower the number of cases, to lower the number of deaths, to lower the number of hospitalizations. And that is what is going to give us the foundation that we can build upon to come out. And while many people continue to implore immediate action, I want to remind that yesterday Dr. Anthony Fauci provided a very direct message to those entities and jurisdictions that are moving too quickly. To quote him directly, he said, "It's going to backfire." That is the problem. Yesterday, we laid out some guidance on what it will take for us to begin to consider reopening parks, trails, and beaches, along with some specific guidance to businesses about preparing for the next phase. And that is the work that needs to start so we are ready when it is time. But to be clear, the decision on when to open up will be determined by data. The guidelines will be developed by public health experts in consultation with state and federal leaders. It will be a public health, public safety-based decision, not a political decision and not an emotional decision. It will be one based on the data about what best serves our region and provides the smoothest and most consistent recovery. To do otherwise would be irresponsible. We can look to history for a few examples that can help guide us in terms of shaping experiences from this. The most common scenario that we are facing when you look historically is the 1918 flu pandemic. And I want to bring up a chart. It's a little bit crowded, and I'll break out a few of these. But what you can see in this instance is a number of jurisdictions that acted too late on the front end, and they saw significant spikes. The numbers in gray here represent deaths per 100,000 residents. And so you see a number of jurisdictions that acted too late and saw a significant spike. You saw a number of other jurisdictions that came out too early and saw second waves, and then sometimes second waves that were much more significant than the first. Second waves that required, as you see there in the tan box, the reimposition of social distancing, physical distancing measures, many of the same things that we are doing today. If we go to the next chart, you'll see in a few specific examples. Philadelphia being an example of what we did not do here, but what you did see play out in multiple places around the world. Philadelphia waited 8 days after their death rate began to climb significantly to take steps and actions, and by that point it was too late to stop the overwhelming of their healthcare system and the significant spike in deaths. If you look at New York, that is more a testament in 1918 at least of what should be done. They started early, they endured their wave, they held the appropriate amount of time, and they came out smoothly. When you look at the example of St. Louis, it's an example of what you don't want to do, where they had a relatively gradual climb, they flattened a little bit, they came out too early, they saw exponential growth, and both San Francisco and St. Louis are representations of prolonged periods of death beyond the initial wave. And it is vitally important to us here in San Diego County that we learn from these lessons and we apply these lessons in order to ensure not only the best protection for the health and safety and life of our residents, but also the best protections for the economic development. In order to have a smooth economic recovery, we have to align the interest of public health with the interest of rebuilding and reopening. I want to bring back an updated chart that gives us a more present-day example, that of Singapore. Singapore had widely been touted in response to this COVID response in 2020 as the gold standard. They took early aggressive action. They did not see a huge spike. And then as they are ahead of us, they did see significant increases after having initial positive success. The orange graphs here represent the actions that we took and our positive cases that you can see right there. The dotted blue line represents what would happen if we would follow Singapore's trajectory. And again, Singapore was widely touted as having done everything right on the front end, but they lost their focus, they lost their commitment, and they saw significant increases after all the sacrifices has been made. We don't want to replicate the mistakes of 1918, and we don't want to replicate the mistakes of other countries and jurisdictions in 2020, which is why we continue to ask you to please help us, join with us in the month of April, being a month of action, being a month of commitment, being a month of sustained progress that can lay the foundation for what we would like to see and will give us the best opportunity to open up moving forward. Let's jump into our daily charts. Again, today you'll see here we're representing a total of 109 positive cases, which is our single largest day jump going back to April 4th to bring us to a total of 2,434 positive cases. No significant change in the number of testing that was reported. Yesterday we were reporting 1,016 tests, which is right in line with about what we've been doing most days recently, bringing us to a total of just under 35,000 tests total for San Diego County. Here you can see the breakdown in positives versus tests. And again, we will begin providing this in a day-to-day breakdown of the daily percentage of positives versus tests. You can do the math with the last charts, but we'll work on graphically demonstrating that to you. The next chart represents our total positives, which we just reported, 2,434. That puts us presently at a doubling rate of every 24 days, down a little bit from yesterday. Our estimated recoveries, which you see right there, the increase in hospitalizations along with the hospitalization doubling rate, increase in ICUs, and the additional loss of life, 15 additional losses of life, but the 15 in parentheses there represents the doubling rate of deaths and not the total increase for today. Our other metrics, motel rooms, very little change in those today, slightly down in the public health, flat, up a little bit in the RTFH rooms. On our outreach efforts, increases in pretty much every category, 211, nursing, epi, jump and hygiene kits, an increase in 10 additional hand washing stations that have been deployed, and portable toilets remain flat. Personal protective equipment, again, we had another day with an increase in every single category. This represents individual items of personal protective equipment that we at the county are distributing to our healthcare partners. Every category going up in the last 24 hours, now putting us at more than 2,250,000 individual items of personal protective equipment that have been distributed. On ventilators, we're looking at 22 of 23 hospitals reporting their availability, presently standing at 540. Along with over 100 that are in the county possession and are ready to deploy if they were needed. That concludes my report. I'll turn it over to Dr. Wilma Wooten for our public health officer briefing.